Good evening, Los Angeles. Today is March 4th, 2021, and it was 1 year ago today, on March 4th, 2020, that I declared a state of emergency in our beloved City of Angels. At that moment, we could not know what the scope of the COVID-19 crisis would be. We couldn't have imagined the crushing toll that it would take on our cities, visit upon our families, our communities. We couldn't predict that it would be the first day of the hardest year of our lives. That life in our city and our world was possibly going to change forever. But while we prepared quickly for the worst, on that critical day and every day that came after it, I was honored to witness this city at work. I saw Angelinos responding with courage, compassion, with quickness. I felt the extraordinary care that the residents of this city have for one another. I saw medical experts begin to educate us, first responders and hospital staff begin to protect us, key workers start to sustain us. And that night was a turning point for each and every one of us. But tonight, 1 year on, we're at another turning point, and we can see hope holding to the horizon. 1 year later, we have a clear path forward, Los Angeles, out of this hell that we've been living in for the last year. But looking ahead, it won't be automatic. It won't be easy. And yes, we will still face headwinds. Our public health experts at every level, from Dr. Walensky at the CDC, Dr. Ferrer here in LA County, Dr. Fauci, and so many others, have painted a vivid picture of what's at stake right now. They've said the good news is that it's very possible that we're headed towards a more normal summer, that summer 2021 will be more like summer 2019 than summer 2020. That here in Los Angeles, we're on track to a less restrictive tier, a moment when the state of California allows us to begin opening up our economy and our society, our social interactions even more. That in the United States, we could be in the last few miles of this terrible race that we've been running, close to putting this awful pandemic behind us. Every day, more Angelinos are vaccinated. Every day, winter retreats and warmer weather is coming. Every day, we remain committed to doing those little things that collectively have such a big impact on how we could defeat this virus. But the experts also tell us something else, that the future is not guaranteed. It won't be easy, nor will it be automatic. Data projections show us that this period that we're in right now, March through May, is absolutely critical. That if we let up our guard now, if we stop wearing masks, if we ignore public health guidance, we could see a fourth wave in this country. And we know what each wave brings. More people who are sick, more people who are hospitalized, and more of our beloved brothers and sisters who die. So let's take this moment, my friends, to accelerate our progress, to keep up our efforts, to double masking when we're in public, keeping a safe distance, making sure our spaces are well ventilated, getting vaccinated when our turn comes, and we can stop this suffering and end the pandemic. We've seen the evidence already in studies coming out for healthcare workers. When they get vaccinated, we see the cases plummet, some cases by 95%. And infections here in Los Angeles continue to drop, thanks to your good work. 19% just since last week when I spoke to you last. Hospitalizations are dropping too, almost 30% since last week. The number of patients in intensive care units is at its lowest level since the end of November. But cases are still too high. Let's not rest too easy. With 7,470 infections reported this week, 2,253 infections reported today alone, though that probably included some backlog. Our 7-day average daily case rate is now 1,577, dramatically down from our peak, but still too high. Think about it this way. As one medical expert, Dr. James Hamblin of The Atlantic, put it, Ending precautions now, which I know there's a lot of pressure to do, it's kind of like entering the last miles of a marathon and taking off your shoes and eating several hot dogs. That illustrates just how absurd it would be if we were to suddenly let up, let that virus back in, let COVID-19 win even as we have more tools to fight it than ever before. So we're not going to do that. We aren't about to give in or give up. We've simply pushed too hard. Too many of us have sacrificed too much, and we've come too far. So our city will finish strong. Los Angeles, I know that we have the fortitude and we have the foresight to be able to make sure we finish strong, saving as many lives as possible. One way we're doing that is by building up our vaccination infrastructure. As I've said, there'll be 3 phases to this vaccination rollout. At the beginning, we're still there, not enough vaccines. Second, not enough capacity for the vaccines when they do come. And we're working hard to avoid that problem here in Los Angeles. And then the third phase, when we don't have enough people to meet the vaccines. And we're working hard to educate people to make sure those 2 phases aren't a challenge for our city. As of yesterday, the city of Los Angeles has administered nearly 500,000 doses of our vaccinations at vaccination sites run by the city. A 23.7% increase since last week, which is great news. We've been waiting for more doses, we're starting to see them, and we will see them accelerate more and more in the coming weeks. And we've gotten more than 90% of our supply into the arms of Angelenos. We've also ramped up our efforts to make sure that everybody can get a vaccine, that equity is the prism through which we refract everything we do, to make sure that left behind communities or communities that aren't at the same point of the starting line, or that folks who are shut away or shut out do get vaccines as well. And this week, our vaccination efforts got a boost with the FDA's authorization of the Johnson & Johnson vaccine. This was very exciting news for me, for all of us. As you know, we're using the other FDA-authorized vaccines here in LA, Pfizer and Moderna, 2 shots. But the Johnson & Johnson vaccine is just as effective as the others of keeping you out of the hospital and keeping you from dying. And it only requires 1 dose. With Johnson & Johnson, in other words, we're able to protect twice as many people with the same amount of supply. Right now, those doses are limited, but they're already on their way here to Los Angeles. We'll be getting a small shipment this week and administering them at city sites. We'll probably have to wait a few more weeks for the second batch to come in, but we're preparing for them. And we're going to use them consistently together with Pfizer and Moderna across our city to move towards our goal of making LA get the herd immunity we need to reopen Los Angeles. Here's the bottom line, though. All of these shots work. All of them will save your life or the life of a loved one. And every day in Los Angeles, we're making it easier for people to get a shot, including those who face steep barriers. In the last few weeks, we've opened up an express lane for people living with disabilities to make sure they can get in and out of Dodger Stadium with a dedicated lane. We've scaled up our partnerships with local community groups that we've worked with for decades, trusted folks who can bring doses directly to at-risk populations in their neighborhood, with council members whose staff, together with mine, are out there working the lines to make sure in your neighborhood, the mobile clinics that we have are bringing vaccinations to your neighbors. And tonight, I can announce a new effort to get life-saving vaccines to LA residents who are homebound due to chronic disease, disability, or other reasons. We've been piloting the Dependent Homebound Population Vaccination Initiative, or DHP initiative, deploying teams made up of our firefighters and core personnel straight to the homes of this vulnerable population. Maybe one of you listening tonight on this address. And in partnership with our city's Department of Disability, the County Department of Public Health, and other trusted community groups, DHP teams are going directly to Angelenos, administering vaccinations at their homes. This initiative builds off of other successful efforts to bring critical COVID-19 services like testing and vaccines to skilled nursing facilities and other vulnerable areas that might be higher density, communities of color, or lower income parts of LA. Our goal in this pilot phase is to vaccinate 300 homebound seniors in the coming week, and then to grow the program from there. We'll also serve folks that are living in public housing developments, senior centers, and other long-term facilities. All of this springs out of our campaign for equity. to make sure that this value is front and center in everything that we do, the lens for every facet of this response we've had to bring this pandemic to an end. Our push for equity led us to putting mass vaccination centers closer to communities in greatest need. And tonight, I'd like to make another exciting announcement that starting on Tuesday of next week, USC's University Park campus will serve as the newest city-operated vaccination location with the capacity to administer thousands of doses per day once we're at full capacity. This number will be initially limited due to supply constraints, but ready to jump into action and grow as those doses are delivered in the coming weeks to LA. And I want to thank Dr. Carol Folt, a great USC president, and everyone at USC who has worked so hard with our fire department and others to get this site ready. Our focus on equity has also led us to take steps to close the physical gap between Angelenos and life-saving vaccines. That's the purpose of our MOVE teams, those mobile outreach for vaccine equity teams that are bringing vaccinations directly into Chinatown, the Northeast San Fernando Valley, to the east side and northeast side of our city, and to South LA. I've always said when people ask, how can we get more vaccines to communities that need it? It's about the 4 T's. First, tell the truth. You have to tell people how effective these vaccines are, that you can trust them, they've been tested, and make sure, second, that you use trust. Those community partners that people go to all the time for healthcare, for advice, for the people that we already know, especially in vulnerable communities, that fill that need for our material and health needs every single day. So truth and trust. The third T, of course, is technology. Meet people where they are. Don't assume everybody has a broadband connection and a laptop. Make sure whether it is call centers like we have right now, actively finding folks to make sure we can get them a vaccination, or coding things to be good for your mobile phone, just like it would be for a laptop. Technology is critical. But the fourth T is transportation. Access to a vaccine means nothing without transportation to connect you there. And for many people, that means a ride to one of our vaccination sites. So tonight, we're launching a new initiative to take another step forward in vaccine equity, a partnership to give Angelenos a ride to our newest vaccination site at USC. We're starting with an extraordinary contribution from Uber, which is providing 15,000 free rides to pick up residents in South LA and to take them to get vaccinated. Not stopping there, the company is also putting another 20,000 rides, half off, to get people to the USC Vaccination Center. All told, they're kicking in this program with $500,000 worth of rides, the largest commitment of its kind anywhere in the United States. So at a moment when too many people in our city might qualify for the vaccine but don't have a car or a ride, we're going to make sure you get to your shot. Beyond Uber's generosity, this has been made possible by the work of the Mayor's Fund, and I want to thank all of them, the board and staff members, who have been such a key partner throughout this pandemic. You've heard me share those stories every single night of the amazing, dedicated folks at the Mayor's Fund. They've been crucial to our vaccination campaign now, too, working with us to roll out mobile sites more quickly, build a system to contact residents who need a little extra help, and to fund the transportation resources that are getting Angelenos to their shots. This work is saving lives. And right now, the Mayor's Fund is focusing more and more on those mobile teams, more on transportation, and providing more support for outreach to vulnerable populations, including our seniors and people with disabilities. So why don't you join over 12,000 fellow Angelenos and help donate to the Mayor's Fund at mayorsfundla.org and make sure we can continue the momentum of this critical, critical work. This is only the first step in this last chapter of this book. This chapter that will show the very best in us, rising to this moment when we saw that hope on the horizon and we ran towards it. It'll get us closer to the end of the pandemic and we will continue to work hard to make sure, as I've always said, that we never stop here at City Hall, getting you the services that you need, the resources and the tools you deserve to rebuild, to recover, and yes, to reimagine a city. You see, meeting this moment also means taking care of those who have taken care of us, including those who have kept our city moving through the most difficult chapter of our lives. That's why yesterday I was so pleased that the city of Los Angeles moved forward when the city council passed and I signed a $5 per hour hero pay wage increase for our grocery and drugstore workers who have been serving on the front lines of this pandemic, supplying our families and putting their families at risk every day. With this legislation, we say here in Los Angeles that we see you and I honor you. Both of my grandparents, my father's parents, were involved in food services or part of the food service union. My grandfather was a barber. My grandmother worked in a meat factory, a meat packing factory. I know how backbreaking this work is, and we want to reward that work. Just as we've seen other industries, nurses get bonus pay, it is time for us to recognize, as we said from the beginning of this, that when you're working at a grocery store right now, you are a hero to us. 26,000 workers who've served our communities with dignity and with courage, and I want to thank the City Council for their leadership and courage as well. Sometimes people forget that there really are angels in this city. People who get dressed and take up their work as a mission here in Los Angeles, to take care of people whose names they don't know, and many times people who will never know their names as well. One of those angels was named Jose Anzora. He was part of the brave men and women who form our Los Angeles Police Department. He was a son and a husband, a hero who suited up just as all of our police officers do each day, to go out there, and after a traffic accident in South Los Angeles, unfortunately, as he was directing traffic, he was tragically hit this weekend. Officer Anzora was much more than a badge and a uniform. He was a human being and part of a community and part of a work family that I know mourns his loss. As last night, he tragically succumbed to the injuries he sustained over the weekend. I witnessed with my own eyes that love that surrounds his family and each one of the LAPD family who knew him and who feel his loss. At County USC Hospital last night, I saw with my own eyes what leading with love is all about. And just the reminder that behind whatever job description we have is a human being made up of flesh and blood, connected by the love and the friendship that sustains us all. I've spent some time with his family and with his LAPD family, and I know that they are hurting, they are grieving so much. To his mother and his brothers, to Heather, his wife. We wrap our arms of love around you. And if you're moved by what you hear, I hope you will help them out as well and support them through their Blue Ribbon Trust, a fund that will send 100% of our donations straight to the family. It's through the LA Police Federal Credit Union, and if you go to lapfcu.org, you can donate tonight. That's lapfcu.org. Tonight, I ask all Angelinos to hold Officer Anzora and his family in our prayers. Los Angeles, what a year this has been. What a long, long year. But the end is in sight, as long as we keep tapping into that deep reservoir of our grit and of our hope. Right now, doing those things that we know save lives. This is how we will keep our families and our friends safe. This is how we will rebuild a Los Angeles that we love. This imperfect paradise, so much work still to do, but we can do it together. Never bet against LA. Never bet against Angelinos. We can end this pandemic. You can end this pandemic. So keep doing your part and keep reminding each other that we're in this together. Stay home whenever you can, and as soon as your turn comes, get vaccinated and stay safe and healthy. Sending you, as always, strength and love. Thank you. With that, I'm happy to answer questions. Take the first question. Thank you.
And that comes from the line of Claudia Pesciuta from KNX News Radio. Please go ahead.
Hey, Claudia.
Hi. Hi. I have a couple of questions.
Sure.
So with the state planning to allocate 40% of doses to the hardest hit areas, I'm wondering if you have any numbers on what that could mean for the city of LA. And then if we could get an update on Project Roomkey, and following up on the LA Times story about this from yesterday, I get that the city is short on staff, but given the financial crisis, shouldn't seeking FEMA reimbursements be a priority right now? And
Absolutely.
with thousands of vulnerable people on the streets of LA, I'm just wondering why the city isn't doing everything possible to get as much money from FEMA to get people off the streets now. Thank you.
Thank you, Claudia. Let me start with your first question. We don't know yet is the short answer, but we're very hopeful. We think that any focus on equity and the hardest hit communities will help Los Angeles. So as long as it's not kind of taken off the top and then just given back to us and the numbers are the same, anything that gets us more vaccines will help. Second, I've suggested to both the White House and to the governor's staff an easy way for us to get equity numbers up, especially as vaccines start coming in. Pick those hardest hit neighborhoods, those hardest hit zip codes, and let us vaccinate anybody in those zip codes. We know that that is an effective public health way. We saw this in other parts of the world when there's been epidemics and pandemics of other diseases. Allow us to go in there and not go through the whole tier system, but to go to a Pacoima when it's hard hit and a Boyle Heights, parts of South LA, and say, we are open for business, set up a mobile clinic, and get everyone through. And if they give us that supply and also take some of the handcuffs of the tiers off in the coming weeks, we know we can step up and help them get their numbers more reflective, not just of the population, but of those that have been hard hit. Remember, it's not just what percentage are different ethnic groups, racial groups, cultural groups in terms of their population. It's the percentage that they've had of deaths, of cases. For instance, the Latino community is about 50% of the population, but 60% of the cases and deaths. So we need to make sure we're getting those vaccines to places that can save life more quickly. In terms of the Project Roomkey, remember, the Project Roomkey is a state and county program that we raised our hand to be a part of, and very proud to do so, with thousands of people that have been helped through this program, 8,000 plus housing solutions that this has been a key part of. Second, I think the article might have been a little bit misleading because there were two things that city staff reported. While we have a whole bunch of FEMA reimbursements we need, we have not missed one single room, not missed one single hotel or motel opportunity because of lack of money. In other words, we have the money here to front that, and we will continue to do that. But absolutely, I want to see that move more quickly. So I spent a lot of the last 24 hours demanding a timeline to get back. We have to get reimbursed for PPE. We've already gotten reimbursement for a lot of the testing. It's done quarterly with FEMA, and it's my expectation that will be done and fully submitted for what we've expended for Project Roomkey up to now, next month. So that is the timeline. I've said, look, we've even given our staff to help other offices and other departments to fill out that paperwork, and that must be a priority. But I want to be really clear to the public out there who thinks, oh, because the city hasn't gotten those reimbursements, that slowed this down. Absolutely not. Not one single room has been or ever will be slowed down by the reimbursement rate. But that said, yes, I do want to see those reimbursements come back quicker. I've been clear about that, and they will be. Any follow-up? Okay. Thanks, Claudia. Next question.
Thank you. And that comes from Ify Rocha from the LA Weekly. Please go ahead.
Hey, how are you?
Hey, how's it going? Thank you, Mr. Mayor. Multiple efforts have been made to get vaccines into Latino communities, but as you've addressed before, there's a level of distrust toward vaccines in the community. Is there anything that the city can actually do to get Latinos to these sites with confidence?
Yeah.
Are there any efforts being discussed?
Yes. Thank you for the question, and near and dear to my heart. When you look at some of the statistics, if you look in the New York Times piece right now that's up about a mortuary in East LA, you see those statistics. East LA, unincorporated East LA, I think it was 388 deaths in the same time period. You saw other cities have a third that rate or a tenth that rate. This is absolutely critical. I probably have a conversation about this every single day with either the White House or member of Congress, with our state leaders, and here locally together with our county and other city leaders. And yes, we're doing a number of very specific things. One is our MOVE teams. Those mobile outreach for vaccine equity teams are absolutely about making sure that Latino and African American populations can get vaccines. And over 90% of the folks getting vaccines through that initiative are either Latino or African American. And depending on what part of town, those numbers might be more African American, might be more Latino, but we're getting really good results. That started with 1, it went to 2, then 3, now 5. I think this week we might have 7, and as I promised, by the end of March, but we'll get there early. We'll have 10 of those teams, which is the equivalent of a mega site, just going into the most vulnerable communities who might not have that ride, might not get the information, might not have the broadband connection, might have language difficulties, whatever it is. Second, we're making proactive calls, whether that's through texting people and letting them know when vaccination appointments are available, or literally just calling folks on their phones in key zip codes right now to schedule their vaccination appointments for them. And we're doing that in multiple languages too, including in Spanish, of course. Third, we're going door to door. I've been a part of that. I've walked and just knocked on doors and let people know when there are vaccination teams that are available and where they are. We don't publicize that on press conference because people will drive from all over town and get there. We want to make sure it's serving the neighborhoods where we set up. So we're working door to door doing that. And then fourth, we're working with trusted community groups and council members who already know whether it's that congregate living facility and senior home, whether it's a community group that works with some of the most vulnerable or lowest income folks, whether that's immigrants. It could be, as you know, in our community, Spanish is a second language for many people, and I don't mean English is the first, after an indigenous language. So we're working with groups like Chirla and others to set that up and to go directly where folks are, with unions like SEIU 1877 and bringing the state mobile teams to janitors and airport workers and others who are among the most vulnerable. So it really requires an all-hands-on approach of communication. I guess the last thing that I neglected to say is we're using key people that are trusted voices. Remember that second T, trust. So we're working both with our national folks to get those key people, whether it's somebody like Danny Trejo, or whether it's a telenovela star, to make sure that people are hearing somebody that they know, that they trust, that this is a safe vaccine, that it's available, and that they should not let their family die. It's a pretty strong message, but it really, that core thing that works the most is don't die from COVID, and don't let a family member die from COVID. You're going to get one of two things is going to get into your body, either a needle or that virus, and one of them kills, and the other one saves lives. Thanks. Any follow-up on that? Okay, next question. Thanks.
Thank you. And that comes from Joe Pollack from Breitbart News. Please go ahead.
Hi, Mr. Mayor. How are you?
Hey, Joel. Good. How you doing?
Good. One question about education and
Yep.
one about culture. On education, there's been a bit of a dust-up over the school reopening plan that Governor Newsom and state legislative leaders have unveiled. And the UTLA has said that the plan would reinforce what they call structural racism. I was wondering if you could comment on that. And then also on a cultural note, LA being, of course, the cultural center of the universe, there's been a controversy this week that's occupied a lot of people's attention. It's come up in some of the schools as well about books of Dr. Seuss. And I was just wondering if you had a take on that.
It's definitely the first question in a year about Dr. Seuss. Starting backwards, of course. I mean, there are images that are blatantly racist that have kind of no place in 2021. And you can't just look at a book and say, hey, 99% of this is great, and then there is a blatantly racist picture of somebody who is presumed to be Chinese or African. So, I know there's this whole back and forth about whether people are canceling folks. This isn't about canceling. This is about standing up against blatant racism where we see it and just making sure that that no longer is part of our canon. And there's lots of ways to work around that. People can take pages out or change them. In fact, I think a long time before this, it's not a 2021 event, I think there was even a word change in the Dr. Seuss book that made it a less offensive term. So I'm not going to prescribe how it gets resolved, but there's no place for racist imagery, racist language in 2021 for our children. Second, in terms of education, I think, look, we need our schools to be open, and we need them to be open safely. And so I've offered to be helpful with that, whether it's putting aside a day and helping with vaccinations, helping push to make sure that we had that set aside, not just at the state, but now nationally through, I believe, the pharmacies. That's going to be great for accelerating the vaccinations for all school workers, including teachers. Remember, there's school workers who are teachers and school workers who are not, and all of them must be vaccinated. So this back and forth, that's the way you avoid structural racism, is by making sure that we get in there, get people vaccinated as quickly as possible, and help teachers have the resources and take the lessons of the successful places that have been opened, whether it's a recreation center like we've had for a year with children, successfully spaced out and being educated, or whether it's in other countries or states that have done that. We've got to stop running away from yes. We've got to figure out a way to collectively say, that is my goal, whether I'm a union, whether I am a teacher, whether I am an administrator, whether I am a parent. There's plenty of fear out there, but we know how to do this, and we now see that light in terms of vaccination at the end of the tunnel, and I support that prioritization. Any follow-on, Joel? Okay.
Well, what is your favorite Dr. Seuss book? That would be
Probably Yertle the Turtle. I always was a sucker for that. I mean, the Grinch as well, but Yertle the Turtle. How about you?
Oh, the Places You'll Go.
Yeah,
My favorite.
For sure. It's kind of my life story. All right, next question, please.
Thank you, and that comes from John Rigardi from the Los Angeles Magazine. Please go ahead.
Hey, John, you got anything on Dr. Seuss?
Hello, Mayor. Thank you. Mayor, you have referenced, not taking our foot off the gas. You said tonight that the period from March to May is crucial.
Yep.
But can you discuss what plans you might have for reopening the economy and loosening restrictions
Absolutely.
on business within the city and at city facilities?
Yep.
Be in favor of, for instance, allowing indoor dining in the near future if levels continue to drop, or gyms, or potentially allowing outdoor activities at city parks, including bringing back those basketball hoops.
Yeah, absolutely. I'd love to see basketball back, as I know you would too. Look, call me boring and consistent, but absolutely, if the public health advice says that the time is right. And I think that we're getting close. I would say don't hurry, don't be so over-eager that we lose a step and that we lose a lot of lives. We've done that before. And a lot of it will depend on that vaccine supply and the data that we're getting of the effect of vaccines. I would say more people want to get open more quickly, get more folks saying yes when vaccines are available. We're not at the point yet where we have so much vaccines where we're looking for people because we're turning down the supply because we don't have enough patients. But we need to have more patients for vaccines, and we need to have more patients on the reopening. I would very much welcome, if that's the public health advice, that we're ready to take baby steps. My understanding is the county will look at the red tier when we get there, and we could get there in the next couple of weeks potentially if these numbers hold or continue to go down. But it doesn't mean you have to open everything in the red tier. It just allows for that. So why don't we test a couple things, do a couple things that would help us. But let's be clear, I think for me, our children, our schools have to be at the top of the list. We can't rush to do other things if that affects our ability to make those schools open. Secondly, is I would say, because you open this door, reopening our economy and getting our economy going is about much, much more than what we reopen. It's really also about the vision that we have for Los Angeles and the investments we make. And so I am doing a lot of work with stakeholders and starting to convene them, whether it's neighborhood groups, whether it is unions, whether it is our large employers, whether it's certain sectors, to begin that conversation of what we can do to lead the recovery back. Maybe it's that we waive some permits for businesses to be able to be in business for this coming year. Maybe it's to double down on things like the outdoor dining that we've permitted on our rights of way and have that blossom for years to come. Maybe it's looking at empty retail spaces and allowing zoning for people to have other uses for them so that the streetscape gets activated. Maybe it's investing in key demographics like our youth of color who have been left behind, or women who have been so decimated by what happened when we saw employment in the United States go up by 16,000. That was because went down by 140,000. Men gained 16,000 jobs in December, while women lost 140,000. So I think those things I'm really looking forward to doing as well, because if we have a plan for how to come back, not just on what's open and not, but what we're investing in long term, that's going to make us, I think, have the prosperity Los Angeles can depend on for a long time to come. Any follow-on?
No, that's it. Thank you very much, Mayor.
Okay, thanks. Next question, please.
Thank you, and that will be in Spanish, and it comes from the line of Victor Cordero from Estrella. Please go ahead.
Hola, Víctor.
Alcalde, ¿cómo está? Muy buenas tardes.
Buenas tardes.
I'm going to ask my questions in English and then I go to Spanish. I'm going to
Okay.
be as quick as possible because I know you got to go. But you spoke already about schools and the process. Now that seems like we are seeing the light at the end of the tunnel. And so if you can elaborate a little bit on that in Spanish.
Yeah.
Number two, I remember it was March 13 last year, and I was connected when you said to Angelinos that our life was going to change forever.
Yep.
It was something crazy to hear, but obviously a year later we see that it has. At the same token, people in Texas and Florida are doing things different. I know you have nothing to do with those states, but what would you say to people that say that we haven't done the right thing by closing the economy and by overreacting, if you will? Not my words, I'm just saying what other people say. And that's pretty much what I have to say. And also, if you have a message to those people in Spanish so they can go ahead and get vaccinated. Thank you.
Thank you. And absolutely, I'll be encouraging that in my general comments in Spanish as well. But let me talk about both those questions. Schools reopening, I've hit in English, so I'll go straight to Spanish. Es importante abrir nuestras escuelas, pero en una manera segura. Y gracias al gobernador Newsom y su trabajo a traer los dosis de vacunas por los empleados de los distritos escolares. Es importante, no solamente por los maestros, pero los trabajadores en escuelas, a tener prioridad, porque nuestros hijos deben tener prioridad también, con reapertura de nuestras escuelas. Familias, nuestros jóvenes están sufriendo y ellos merecen la capacidad para abrir las escuelas, especialmente a nivel primaria. Es mi esperanza que en este próximo mes tendremos la oportunidad de abrir nuestras escuelas a nivel primaria por este año. Discúlpame. Pero necesitamos hacer más. No solamente es los dosis de la vacuna, pero los recursos para invertir en nuestras escuelas, por la ventilación, por la salud, por todas las cosas que necesitamos para reabrir seguramente. Segundo, la segunda pregunta está la diferencia entre California con otros estados como Texas y Florida. I'll say something in English first, and then I'll go back to Spanish. So the question came up, I think it was last week as well, and I absolutely 100% stand behind the decisions that we made. The most difficult decisions of my life, but in many ways the easiest ones. We can only count the lives lost, not the ones that are still with us because we did the right thing. California, and Los Angeles in particular, is much more dense and more vulnerable on the CDC index than other states, including Texas and Florida, where per capita Texas has had more cases, where we see another huge surge going there. We, given our vulnerability, have saved thousands of lives. That's going to be better for the economy long term, and that means that our loved ones are here. So I absolutely 100% stand behind that. Nuestras decisiones en este año pasado, en una ciudad más vulnerable de Texas y Florida, con más densidad, más pobreza, estas decisiones han salvado las vidas de nuestras familias. Y yo tengo mucho orgullo de estas decisiones. Fue muy importante. Nosotros no podemos contar las vidas que están en la ciudad, solamente las vidas perdidas. Y estas acciones han salvado miles de angelinos. Cada vida preciosa, cada vida importante, cada familia preciosa. Por eso, gracias al liderazgo en este estado, el liderazgo en este condado, y con mis acciones como el alcalde de la ciudad de Los Ángeles, el éxito, estamos en el medio de los estados, en los fallecimientos, los casos, pero estamos en el nivel más alto, en la vulnerabilidad. Y por eso es un éxito, en mi opinión. With that, I'm going to switch over, and I'm going to speak about the vaccine in Spanish too, so don't worry, Victor, I'll get to that as well, and I'm going to say a few words in Spanish. Thank you again to everybody tuning in English, who's logging off or tuning out, and we'll see you next week. Thank you all, sending you much strength. Muy buenas tardes, Los Ángeles. Hace un año, en el 4 de marzo del 2020, yo declaré una emergencia en la ciudad de Los Ángeles. En ese momento no sabíamos el alcance de la crisis o el sufrimiento que llegaba. Sin embargo, respondimos con coraje y ahora tenemos el poder de determinar nuestro futuro. Nuestros expertos médicos nos han dicho que es muy posible que tengamos un verano más normal este año y que podamos lograr un nivel de menos restricciones para poder abrir más actividad económica. Sin embargo, también nos dicen que este futuro todavía no está garantizado y que fácilmente podemos perder nuestro progreso. Este periodo de marzo a mayo es crítico. Este capítulo es crítico. Si dejamos de usar mascarillas y comenzamos a ignorar las recomendaciones de salud pública, muchas más personas se pueden enfermar y morir. Pero si mantenemos nuestros esfuerzos, usar doble mascarilla, mantener una distancia segura, recibir la vacuna cuando llegue nuestro turno, podemos acabar con la pandemia. Las infecciones y hospitalizaciones en el condado de Los Ángeles siguen bajando y tenemos el número más bajo de pacientes en las unidades de cuidados intensivos desde el fin de noviembre. Pero los casos aún son demasiado altos. Tuvimos 7,470 nuevos casos esta semana y 2,253 hoy. Pero no estamos a punto de parar nuestro trabajo. Nuestra ciudad terminará fuerte. Nos protegemos unos a otros y salvaremos vidas. Nuestro programa de vacunación está ayudando a cumplir esta meta y nos permite administrar vacunas a residentes para prevenir enfermedad severa causada por COVID y la muerte. Estas vacunas son seguras y efectivas para protegerlo a usted y a su familia. Ya están salvando vidas. Desde ayer, nuestra ciudad ha administrado 467,654 dosis en nuestros centros de vacunación y hemos distribuido más del 90% de las dosis que hemos recibido. Y esta semana, la FDA aprobó la vacuna de Johnson & Johnson. Como saben, las otras vacunas que usamos en Los Ángeles, Pfizer y Moderna, necesitan 2 dosis. Pero la vacuna de Johnson & Johnson es igual de eficaz para prevenir enfermedad grave y muerte y solo requiere 1 dosis. Con esta vacuna podemos proteger al doble de personas del COVID-19. Ahora las dosis de Johnson & Johnson son muy limitadas, aunque vamos a recibir algunas pocas para administrar en la semana que viene. Pero cuando lleguen más en abril, vamos a poder administrar más personas y llegar más cerca a lograr la inmunidad colectiva. Todas las vacunas son efectivas para salvar su vida o la vida de alguien que usted ama. Nuestro trabajo para ampliar el acceso a la vacuna nunca para. Esta noche estamos anunciando un nuevo programa para proporcionar vacunas a residentes en Los Ángeles que no pueden salir de sus casas debido a enfermedades crónicas, discapacidad u otras razones. Lanzamos una iniciativa piloto de vacunación para personas dependientes confinadas al hogar, DHP, desplegando equipos de vacunación directamente a estos residentes. Nuestra meta esta semana es vacunar a 300 personas de la tercera edad que no pueden salir de su hogar y pensamos ampliar el programa a largo plazo. Además, esta noche estoy anunciando otro centro de vacunación. Empezando el martes, estaremos administrando vacunas en USC, la Universidad del Sur de California, con la capacidad de administrar miles de dosis al día. Y para asegurar que el transporte no sea una barrera a la vacunación, también estamos anunciando una asociación con Uber para llevar a los angelinos a este centro de vacunación. Uber está ofreciendo 15,000 viajes gratuitos para llevar a los residentes cerca de USC, en el sur de Los Ángeles, a vacunarse, junto con otros 20,000 viajes a medio precio, una donación valorizada a $500,000 de viajes. Gracias a Uber. Y estoy agradecido a Uber y al Mayor's Fund de Los Ángeles para realizar este programa. Si usted puede, visite mayorsfundla.org para apoyar este gran trabajo del Mayor's Fund de Los Ángeles para traer más vacunas a más comunidades. Mientras luchamos contra el COVID-19, seguimos el trabajo para asegurar que nuestros residentes tengan todos los servicios, recursos y herramientas que necesitan. Ayer, el Consejo Municipal aprobó un aumento salarial de $5 por hora para los trabajadores de supermercados y farmacias que han estado en la primera línea de esta pandemia. Y para mí fue un orgullo firmar la ley. Yo quiero agradecer a mis colegas del Consejo Municipal por su liderazgo en este esfuerzo. Como un nieto de trabajadores en esta área, yo tengo mucho orgullo en este momento y nosotros podemos ver los trabajadores en nuestros supermercados y farmacias. Gracias por su trabajo. De vez en cuando nos olvidamos que realmente hay ángeles en nuestra ciudad. Uno de esos ángeles era oficial del Departamento de Policía, José Anzora, un hijo, un marido y un héroe que ponía su vida en juego cada día para protegernos. El oficial Anzora era un servidor público dedicado a nuestra ciudad. Y el sábado pasado estaba dirigiendo el tráfico cuando fue atropellado por un vehículo. Y anoche, trágicamente, falleció. Usted puede apoyar a la familia del oficial Anzora a través de un fondo que enviará el de 100% del dinero recaudado para ayudar a la familia a superar ese momento tan difícil. Si usted puede ayudar, por favor, visite lapfcu.org. lapfcu.org. Pido a todos los angelinos que tengan al oficial Anzora y a su familia, su mamá, sus hermanos, su esposa Heather y nuestras oraciones. Los Ángeles ha sido un año muy largo, pero ya se acerca el fin de esta pandemia. Ahora, usando 2 mascarillas en nuestra mejor defensa contra el virus, también con la distancia social y siguiendo las directivas de salud pública. Así que sigue haciendo su parte en esta batalla. Quédense en casa cuando pueda. Y cuando le llegue su turno, vacúnese. Quédense seguros y sanos. Fuerza y amor, Los Ángeles. Muy buenas noches. Good night.